is evidence that more can be achieved, and again, a lot of this comes from India. I mentioned Dr. Arole's program, and we did an evaluation of that. His program, which started in the early 70s, reduced child deaths by around 30%, at a time when the child mortality rates were similar to what we observe in parts of Africa. There's the SEARCH program by Dr. Abi Bang and his wife and others, which similarly has reported very large reductions in child mortality through interventions which are well designed and well measured and can be repeated elsewhere. And then more recently, there's a group by Anthony Costello and others at University College London, which helped us motivate Champion. Those people have done tests in 7 different regions around the world of training of village community participation groups to help women who are pregnant reduce neonatal mortality and improve the survival odds of children. And they found generally good success, but some mixed success when they implement these projects, but reducing neonatal mortality rates by on the order of 30%. So there are things that can be done and that aren't obviously being done yet. What we decided was we would continue to try to build on this evidence using their learning and applying this around the world. And our goal is to contribute evidence showing how and whether it is possible to rapidly and significantly change children's health and education in these pockets of poverty that we observe anywhere in the globe, really. And our way of dealing with this is, first of all, we don't bring expertise on the interventions generally, and we don't want to if we can avoid it. We find excellent local partners like the NICE Foundation who understand much better the issues. But what we do bring is that we work to measure the outcomes very carefully. We help find sponsoring for the projects. We work with partners like the people at London School of Hygiene and Tropical Medicine who know how to measure very accurately changes in what we're trying to target, and we measure those things rigorously. We focus always on outputs. We focus on improving education, test scores, not on enrollment. We focus on measuring mortality, not on the inputs into reducing mortality. Our contributions in India, as I've said, we've done the CRHP study, Champion, and I'll briefly mention Stripes as we go on. Champion was aiming to reduce child deaths, neonatal mortality. Stripes, which Diana briefly mentioned, was in the same region, but in the control villages, and there our goal was to improve children's numeracy and literacy, which over a 2-year period through after-school education programs.